Hey everybody, I'm Maggie. We're back on another segment of SRH Access Facebook Live. Today we have a privilege of being with our Assistant Chief of Staff and our Chief Quality Officer, Dr. Lori Karol. Welcome.
Thank you very much.
It's been a while since we've had you on, probably a year or so.
Yeah, it has been a little while, but we're glad to be participating.
Yes, we're so excited to have you because today we're talking about something really cool that all of our doctors are a part of, and that's POSNA. So how about you give us a little insight on what that is?
Well, POSNA is the Pediatric Orthopedic Society of North America. It is a group of pediatric orthopedists that pretty much represent everyone in our field. Our current membership is just over 1,400 members, and it is primarily pediatric orthopedic surgeons, but we also have a small group of researchers that belong. For example, our researchers here at the hospital, Karol and Jonathan Rios, belong to POSNA. Additionally, there are some nurse practitioners that belong. So it's really a group that is heavily invested in three things in pediatric orthopedics. The big mission of POSNA is education, and whether it's education for pediatric orthopedic surgeons, education for our residents and fellows, or education for our families, it's a major focus of our group. But we also support research with research grants, and we support patient advocacy and become involved in many ways in being advocates for our patients and the needs that they may have.
I know we were talking right before this is an annual meeting that we go to every year, and we always normally have a pretty strong impact. I mean, this year we had, 23 projects that were presented?
We counted it up. I think Dr. Scottish reported we had about 16% of the scientific program. So to explain the scientific program, when October comes around, we all send in our reports of our research projects that we've been working on. We cross our fingers that will be accepted for presentation. We've been very successful in having our projects accepted. The presentations are 4 minutes long, so you have to get in there and know your message quickly. But it's followed by 12 minutes of discussion of 3 papers. And that's really where the fun is in the interaction between everybody in the room who represents pediatric orthopedics around the world, asking questions and learning more about the research that we do here.
And I think what people are really excited about when they love seeing our doctors going in travel is that they're realizing that you guys are going around, you're sharing your expertise, but you're also learning from other experts, as you were mentioning, to really bring better patient care back to our patients here.
Absolutely. So not only are we sharing what we've learned, but we're sitting in the room listening to reports from everybody from around the country and around the world and the new innovations that are coming out in pediatric orthopedics. We'd like to think that we come up with all of them, but we do learn from others too.
Right.
And that's been really important in our involvement in POSNA.
Definitely. I know that we in our staff has a very long history of leadership roles. I mean, you were the first female president for POSNA, so that's a very cool accolade for sure.
First and only. So there was a very interesting project that was discussed at the meeting where they discussed the women in leadership and men in leadership in POSNA, and they gave the average age and number of years in POSNA of the men who had been president, and then they did it for me, and I got up and said, I'd like you to thank you all for telling everybody how old I am, and welcome to being averaged in with others in the future.
Right, that's so awesome. But can you kind of give a little synopsis of maybe some other leadership roles that other doctors have had during POSNA and currently? What's going on with
fantastic. That? So leadership at Scottish Rite really began with Dr. Tony Herring. And Dr. Herring was president somewhere between, I should know the year, but it's between 1991 and 1994. And he served for a year as POSNA president. Dr. Steve Richards was the second Scottish Rite president of POSNA. Now, Dr. Jim Roach was a medical staff member here for many years, and he became president of POSNA later on. I followed after that, so there have been, in some way, 4 presidents of POSNA that have served on the staff here at Scottish Rite. But that's not all. So we have had a very strong representation of members of our orthopedic staff being active on the board of directors. And this year, Dr. Dan Scottish, the chief of staff here, finished his term as a director on the board of directors.
Wow, that's just so cool because we know, not only you guys going and sharing this original research, but it's so cool to know that you're leaders, not only here at the hospital, but to everyone around the country in pediatric orthopedics. So that's pretty cool.
It really is.
So let's get down to this year's meeting. I know that almost every staff member was really involved on the orthopedic team and kind of get down to the nitty-gritty of what was presented and kind of what you guys learned.
Well, I'd love to talk about this. I'm going to start out with what I presented. So I was asked to give a presentation on non-operative treatment of children with scoliosis between the ages of 8 and 10. Pretty specific topic. And so I discussed the likelihood that bracing would work and the role that bracing and casting can play in these young children who have curvatures at ages that would be earlier than what we typically expect. Usually scoliosis doesn't occur until after the age of 10. So this is a small fragment of our scoliosis population. And I presented that at invitation during the spine specialty focus group. One of the fellows from last year, Lorena Flocari, worked with me in the movement science lab and with Dr. Tony Herring and Dr. Charlie Johnston in studying the effect of treatment of proximal femoral focal deficiency. Now that's a condition where a baby is born with a very, very small femur, which is the thigh bone, and they require usually some form of amputation or prosthesis to be able to walk normally. And so she compared 3 groups of patients who had 3 different types of surgeries and prostheses. And we had them all walk in the gait analysis laboratory, and we gave them all questionnaires about how they felt they were doing in their everyday life. We call those patient-reported outcomes. And she showed equivalence between the 3 groups, with some patients having more surgery, but not necessarily a better functional outcome than patients that had fewer surgeries, but may have had a different prosthesis that wasn't quite as cosmetically acceptable. So she did a beautiful job of presenting that. And it was very well received within the congenital section of the POSNA meeting. Those are the 2 projects that I was most involved with, but everybody presented. One paper that was very good was by Dr. Craig Birch, who worked with Dr. Brandon Ramo and with our quality team. And his paper was selected for presentation under the quality, safety, and value section of our meeting. And that's a competitive section, which seems to grow each year in importance and in number of presentations. And what he did was a very novel study with our pharmacy, looking at how much pain medication is necessary following a spinal fusion for scoliosis. These days, everybody's talking about the opioid crisis and patients or people in the community becoming addicted to pain medication. Well, we never want that to happen to our children that we treat here. So he did a study where he was able to find out exactly how much pain medication is necessary, and we were able to take our prescriptions and to decrease the number of doses to what was appropriate for the surgery without any increase in call-ins and with very few people calling in for refills. It was a very well done study. And I have to give kudos to our pharmacy, our quality team, and to Craig Birch and Brandon Ramo for that work, which was very well done. Amy McIntosh got up from the quality standpoint, and she reported on a study where we compared patients who had antibiotics given into their incision at the end of a spinal fusion versus those who didn't, and found equivalent results between the 2. And there was a very active discussion after her paper. The audience was alive with questions, and as usual, Dr. McIntosh answered them all very expertly and with lots of enthusiasm.
Yeah, that's great.
Dr. Riccio and Dr. Stutz were both asked to lead sections of the POSNA meeting, Dr. Riccio on foot issues and Dr. Stutz on hand issues. So we even were asked to be leaders within the POSNA meeting in putting together programming in certain anatomic areas. I could go on and on because we did have presentations from just about everybody. Dr. Johnston, Dr. Birch, Dr. Riccio, Dr. Ho presented numerous topics as well. So we were all there and we were all speaking the whole time.
So this is a 4-day meeting. It spans out 4 days. And
It does.
You were talking about these subspecialty days.
Mm-hmm.
What, can you kind of go into what that means?
Oh, sure. Let me bring you through how the meeting is actually structured.
Mm-hmm.
So the first half day of our meeting is on Wednesday, and there's a symposium that's led at that time. And the symposium this year was on wellness, and Dr. Herring and Dr. Sakato were invited to speak during the wellness seminar. The scientific meeting begins on Wednesday and goes through Saturday morning. But on Friday afternoon, we have subspecialty day. So in pediatric orthopedics, there are 2 different kinds of pediatric orthopedic surgeons. There are people like me that do just about every subspecialty, And then there are people that only do 1 or 2 areas within pediatric orthopedics. They're very subspecialized in their care. And so if you happen to be a sports surgeon, you really wouldn't be very interested in coming to hear the scoliosis section.
Right.
So on Friday, we break into different rooms. And so our sports doctors were presenting, Dr. Ellis and Dr. Wilson in the sports room. We had hand rooms, we had upper extremity rooms, neuromuscular rooms, and the spine room. So it's a very, very sort of deeply subspecialized day that day where we can go into great detail in advances in our fields.
Very cool. And I know not only are we're presenting and learning all this stuff, but what about the awards? Because I know that it's pretty remarkable this year.
Well, it's been a great year for Scottish Rite.
Yes.
So there are awards that are given on the scientific program. And so there are papers that are presented at the podium, and then there are electronic posters that run continuously on computers around the room. And Dr. Harry Kim, who I think has a wall full of his awards, has added another one because he was the best e-poster
Wow.
for the meeting. There are also research awards that are given each year. And this year, Dr. Richards received the highest research award given by POSNA. It's called the Arthur Hune Award, and it is given for a body of work that an investigator has been involved in who continues to work in that field. And so Dr. Richards was recognized for his work in clubfoot and received a nice award for that. We've had a nice tradition of Scottish Rite physicians having received the Hune Award, and very well deserved by Dr. Richards. There are also other grants that are given by POSNA, and Dr. Charlie Johnston won a Basic Science Award this year for his work in thoracic growth in patients with scoliosis, and then Dr. Pedeswa won a research award for his work in hip.
Wow.
And so we've been very successful in getting funding for our research projects, and it's a very competitive thing to receive these awards. Now, the greatest award in POSNA is the Distinguished Achievement Award, and that has been won in the past by Dr. Herring. So we're always going to be proud of that.
Oh,
moment.
definitely. And Dr. Herring's just so wonderful.
He's great.
He's known by so many. So kind of to wrap things up, we were talking about how this is an annual meeting, and you were saying that in a couple of years it's actually coming to Dallas.
It is. So in 2021, we are going to host the POSNA meeting here, and that will involve greater than 1,000 people coming to Dallas and spending time discussing their research with us here. And so Dr. Sakato and I are going to be the local hosts, along with our Scottish Rite faculty, putting together what we hope is going to be an exciting meeting.
Oh, it for sure will. Definitely. Well, this has been so great. Do you have anything else to add about POSNA?
Well, POSNA has been such an important part of my career, and it's where I meet with people who do what I do to discuss things that are relevant to my patients. It really comes down to the kids we treat.
Right.
And if I can leave that meeting with 5 or 10 or 25 new things that I've learned, I think that's just a fantastic opportunity for all of us.
That's wonderful. Well, thank you so much for joining us today. I think we've all learned a lot, so we really appreciate it, and we'll have you on next time.
My pleasure.
See you later.